Hey guys, welcome to the first episode in the Intern interview series. Today I am here with Dr. Samantha Vouyiouklis, and she is a Ross University alumni, and she has matched into family medicine at the University of Wisconsin. So today we're going to be talking about just some advice for anyone who's applying for family medicine or anyone who's interested in family medicine in the future if you're an M1 or an M2. And then we'll just be talking a little bit about residency as well. So the first question that I have for you is tell us a little bit about how you got to family medicine, how you decided on going to a Caribbean school, and just a little bit about your journey through medicine.
Yeah, absolutely. First of all, I'd like to really thank you for having me on here. It's such an honor, and I'm so excited to be a part of it. I actually wasn't expecting to go to the Caribbean at first. I unfortunately had a situation in my family where we had a sudden loss of a family member, and it was around the time where I was about to take my MCAT in my junior year of college. And of course, I wasn't really in the mindset to go ahead and take an exam. I was going to determine on whether or not I was going to go to medical school, right? So I sort of pushed my timeline back. And so I started looking at other options. I started looking into the Caribbean. My older brother is a Caribbean graduate. And I realized that the Caribbean was just, their schedule is more flexible for me. With different schools they have different like 2 or 3 enrollment dates throughout the year, whereas American schools only have one time a year. And I really didn't want to wait a whole year out of college to wait to get into medical school. So as soon as I finished college, I took my MCAT and I chose to apply to Ross. And within a week of applying, I had my interview and I was accepted. And in just 2 months after that, I was a first-year medical student.
That's awesome.
Yeah.
Which class did you decide to enroll in? The summer one, I believe there's like a fall class, a summer class, and a winter class. Is that correct?
Correct. Yeah, absolutely. There's usually January, there's May, and then there's the end of August. And I actually enrolled in the January class. So I started January 2016.
Okay, so see, for me, I'm an SGU grad, for those of you who might not know, and I actually was in the fall class. So just out of curiosity, since yours is a little different than mine, do you find that there's any like pros or cons of going in January opposed to August? I guess we could kind of talk about that for a little bit.
Yeah, so I have to say at Ross, our August class is pretty big. It's our biggest class that we usually have at Ross. The smallest is January, and then May is somewhere in the middle. So I didn't realize that when I started. So I sort of realized it as I was going along throughout the year and realized the class size that was coming in after me in May and then in August. I had about 275 students, I want to say, that we started off. And then that August that came up was about 350. So it was definitely a larger class overall. But that's really the biggest difference.
Okay. Yeah, I feel like for us, I get a lot of questions about whether I should start in like August or whether I should start in January. Do I feel comfortable? Do I feel ready? And the answer is you're never really going to feel ready to start medical school. It is a big transition, but yeah, I think for me, the only reason I chose to go in August was because I wanted to kind of be on the same schedule as I guess right. US students were. Like they tend to start in the fall. But it's interesting because the way our third year works, I feel like the January class actually like ends during third and fourth year. They are more on track with the US schedule than if you enter.
Oh, if they start in January?
Yeah.
Oh, wow.
So it's like we start like basic sciences and like are aligned with them, but then because they take step 1 a little earlier than we do, I guess they start their rotations sooner, and then they wind up being like, you guys wind up being on track a little bit more with them, like in the latter years of medical school. So if that's a question that's, hindering whether or not you should apply for a fall class or a winter class, don't let it, because it seems like there's pretty much no difference.
Yeah, and everyone's on their own track. I think, when everyone starts at the same time. But then once you go through medical school and the boards come up and some people take more time than others for the boards, it sort of throws everyone's path that everyone started at the same time. It becomes a little different. So I feel like some people can catch up or some people may fall behind just based on events that occur throughout medical school. So it's true. It's not necessarily a guarantee of depending on when you start, if how your schedule will turn out at the end.
Yeah, I definitely agree. So moving on from that into the family medicine specific questions, can you tell us a little
Yeah.
bit about why you decided to choose family medicine and why you felt it was right for you?
Sure. So I actually didn't know I wanted to really go into family medicine until I started my third year core rotations. I really went in with an open mind. The only thing I knew I really wanted out of a specialty when I entered my third year was that I really wanted to be in a field where I could really connect with my patients, not just treat them medically, but also become a friend to them, get to know them and their family. And with that in mind, as I went throughout my third year, I realized I truly enjoyed a little bit of each specialty. And so I felt like I couldn't um, just focus on one. And when I reached my third core, my core rotation of family medicine, it was like sort of like in Cinderella, the shoe fits. When I was in my family medicine rotation, that's how I felt because I got to see a little bit of everybody, babies, newborns, elderly, teenagers, adults, and then at the same time build those connections with my patients that I was really hoping to have in the future. And so at that point, it was really a no-brainer for me. I knew it's what I wanted to do. I knew it's what I wanted to go into residency for. And after that, everything else was, all the other rotations were just for fun.
Yeah, I agree. That's what I tell a lot of people as well. When you're trying to decide on a specialty, it's okay to like a little bit of everything, but you know where you feel the most comfortable and you know what you can't live without. There's a difference between being interested in something and there's a difference between not being able to live without a certain like a certain part of medicine. And so you'll know what they are once you experience them. And like you said, eventually the other rotations that are not yours will kind of just become for fun.
Exactly. Absolutely. I agree.
And I think the nice thing about family medicine too is you do kind of have the option ultimately to pick the patient population you want to work with. Like you're trained to practice taking care of adults, adolescents, children, babies, pregnant women. But if there's a specific patient population you aren't necessarily interested in working with, you don't have to. So I really think that the flexibility of family medicine is like kind of a pro. Do you plan to do fellowship? Are there fellowships offered through family medicine?
Yeah, there's actually a bunch of fellowships that are offered for family medicine residents post residency. Quite a few of them include sports medicine, obstetrics, women's health, hospitalist, emergency. I'm actually really interested in OB. I've been prior to starting residency, and I was sort of looking for programs that had a robust obstetrics curriculum throughout the 3 years. And there is an obstetrics fellowship and there's other women's health fellowships that are offered after residency, and they're usually about a year long. And so that's something that I'm interested as of right now to pursue after residency. But of course, in residency, I've been told, your mind can change and your interests will change. And so we'll see if that continues to be the plan in a year or two from now.
Yeah, I think that's a great point too, is that you, going into like interviews and stuff, like you're always going to be asked on interviews, like, what do you want to do? Like, what do you want to practice?
The most
Like,
popular question,
such a
hands down.
such a popular question, but also like if you don't really know, you're allowed to say, I don't know, because program directors and attendings, they know that your experience as a medical student in a specialty is not the same as it is when you're a resident. You have so much more responsibility when you're a resident, and you're going to be able to get a much better idea of the lifestyle and just how you care for patients in that like dimension of medicine. So if you're not really sure, that's okay. But yeah, you said you did some work in obstetrics prior to med school.
In medical school, I was really gung-ho in my OBGYN core rotation. There was a point in time where I wasn't sure if I just wanted to do OB or family, but I realized, I really just needed to see every member of the family. And once I discovered that in family medicine, you could further pursue the specialty of OB as a family medicine physician,
Right.
it was sort of like, it was the perfect fit. So I knew going forward that I really wanted to find programs that would allow me to include that in my practice in the future. because every residency program, every family medicine residency program is very different in what they offer, and that depends on people's interests. And so it's really important throughout interview season, before entering the match, to really know what you're looking for, because that's going to guide you in choosing which programs you'd like to interview and send applications to, and ultimately match to.
Yeah, I agree. And I think something else that kind of helps, that helps with is when you're on interviews, and the program director you're interviewing with will always ask you at the end, do you have any questions? And obviously, like, by the end of interview season, you're going to be tired and you're going to be like, I don't really want to ask any questions, but you should always at least try and ask one. And, I get a lot of questions too. Well, what are good questions to ask? The good questions to ask come from here. They come from what you want. So
what you care about.
Like you said, exactly. So it's like, you have to know what you want out of your residency. You have to know what your long-term goals are. You have to know what you want in a program. And those are going to be the questions you want to ask. So like in your case, asking about OB because you were interested in somewhere that had like a robust OB curriculum, those are perfect questions you're going to want to ask either the program director or the residents or whoever's interviewing you on interview day. Those make for excellent questions as well, because ultimately it's your future we're talking about. So programs,
right,
believe it or not, care about you fulfilling your long-term goals. That's part of ranking and that's part of the match. They don't just want applicants to fill their positions, but they want applicants to fill their positions who are going to be able to reach their goals at their program.
And I should mention that AAFP actually has a list of questions for applicants to ask at interviews, depending on who you're speaking to, program director, residents, other faculty members. So that's something that I took a look at prior to interview season and really helped me a lot.
Great. Yeah, I think that's a really great resource also. So for those of you who are unfamiliar, who might be watching this earlier on in medical school, AFP is the
American Academy of
Family Physicians. Yeah, so they're one of like the big organizations for family medicine where a lot of the guidelines come from. So check out their website. It sounds like it's a really great resource for interview season.
Absolutely. Yep.
In terms of preparation for residency application, let's start with like basic sciences. Is there anything you did in basic sciences that you felt either enhanced your application as a family medicine applicant? I know it's kind of hard to say because in retrospect, I know you were interested, I guess, more so in OB when you originally went in, and then you wound up being interested in family medicine. So as an M1, M2, you didn't really know to do like family medicine specific things, but is there anything you think kind of helped you out in terms of getting interviews and matching that you did in basic sciences?
Yeah, so all throughout my time on the island, different clubs that we had, pediatrics club, cardiology club, family medicine club, I got involved with everything because I really wasn't quite sure what I wanted to go into. And so each club offered events to get more information on each specialty, and things that they offered were community events, maybe about once a month. And I lived in the island of Dominica at the time when I went to Ross, and they would set up shuttles, and they would take 30, 40 students, and we would go to different parts of the island, and we would offer, it was a free health fair. And so we would take blood pressure of locals, we would check their sugar, we would do physicals, and just to become engaged in the community and to practice those skills from the beginning, and even skills of just interacting with patients from the beginning. And that came up a lot throughout my interviews. And it showed how much I wanted to be involved with community. And family medicine is all about community. You are the go-to person in a community. If anyone's sick, any problem at all, the first person they think of going to is their family doctor, their primary care doctor, because we're sort of like the entrance to the rest of the world of medicine and all the other specialties. And so it showed how much I really wanted to be a part of the community and care for the community, and at the same time practice my clinical skills and just interacting with patients of all different ages. And that was something that was a really hot topic throughout my interviews.
Yeah, I think that is very great. And I think that so many people need to hear that, because I think everyone's like very focused on, oh, when I am in my basic sciences, I have to be, doing some type of research. And I think your ERAS application goes so far beyond the research that people think is important. So I'm very happy that you brought that up, because I myself was also asked a lot about the community like outreach I did when I was on the island of Grenada, because that's one of the best parts about being there is it's unfortunate they don't have great healthcare, and just kind of, you know, being there for the health fairs and stuff. They know they're coming. There's always a really great turnout, and just, you know, trying to help their healthcare system as much as you can is, I think,
Absolutely.
something that, you know, you can make a really big difference. So thank you for sharing that. I think a lot that will
Yeah.
benefit a lot of people who hear that. In terms of clinical years, is there anything you think helped enhance your application, or anything you think students should be doing to prepare their application specifically for family medicine?
You know, when a lot of students will ask for a letter of recommendation from their family medicine preceptor of their course in third year, and I think it's really important to step out of your comfort zone and try and learn as much as possible, but also become engaged as much as possible, be engaged as much as possible. And what I mean by that is take true ownership of the patients that you're seeing. Doctors would love to see that. They want to see you shine. They want to see what you can offer your patients in the future. And it really goes a long way, because I feel like when I was in my family medicine rotation, I was really lucky enough. I had a wonderful preceptor. I mean, the only thing that was missing is all she had to do was like step out the clinic, and basically I would be able to run the clinic. You know, she just took a step back. She had us go in, you know, we spoke with the patients first, physical exams, we wrote the notes, we put in the orders, and she was just there to make sure that, you know, the patient wasn't injured in any way. And everything was smooth. But it really allowed me to enjoy the role of being a future family medicine physician, and I took it seriously. I took that opportunity seriously, and I think it really paid off, because the letter of recommendation that she wrote me was mentioned to me in every interview that I had, and to the point where in a few interviews, the interviewer asked if they could just take a moment to read to me a few of the sentences from that letter of recommendation. And that in those moments, I realized what my preceptor really thought of me. And at times, you know, it did bring a tear to my eyes and to the interviewer. And you don't realize how much you're doing makes a difference and is really showing, you know, what you can offer. So it's really, and this I think applies to any specialty that someone would like to go into, to anyone, just put your best foot forward and take it seriously, because one day in the future, what you did 2 years ago can really pay off.
Yeah, I absolutely agree. And I think it's hard to know, like, as a medical student, sometimes you feel like you're doing, like, I think sometimes you feel like you're shadowing more so than like doing anything productive.
Mm-hmm.
But again, like, your attendings who are writing you letters, like, they know that you're not a resident, they know that you're not an attending, they know you're a medical student, and they know what level you should be at. And if you can exceed that expectation of theirs, you're going to get a great letter of recommendation. And it sounds like that's exactly what you did. It sounds like you had some amazing letters of recommendation, and that makes me very, very happy, because I feel like if someone did that to me in an interview, I'd probably start crying.
Yeah, it happened a few times, and I you know, I never heard of no one had ever told me that that can happen during interviews, and it was a really nice surprise. But definitely letters of recommendation can go a very, very long way.
Yeah, I absolutely agree. Because I think sometimes a lot of them can be very generic, because every medical student, I feel like, you have to try to be below average, but I feel like in general, like, everyone's pretty much average. But
Mhm.
that means that everyone pretty much gets the same letters of recommendation, which means programs are reading 3,000 times
The same thing.
12,000 of the same letters. So if you can earn a letter, you have to earn the letter. But if you can earn a letter that really makes you stand out, that is such a huge pro and such a huge, you know, check mark in the positive column for you ultimately. So take your rotations seriously, especially the one you want to apply to. But honestly, take all of your rotations seriously, because they're called cores for a reason, which means that you need to know medicine. So
They're the basics. You need to know the material. Every person who's a physician now for 30, 40 years has been in your shoes and had to go through what you're going through, and they know that basic information.
absolutely. So in terms of standing out during your family medicine rotation, and earning a great letter of recommendation, do you have anything in addition to taking ownership of your patient? Because I think that is that's such a huge thing for getting a good letter. But any other tips for standing out on your family medicine rotation?
Absolutely. So I would frequently ask my preceptor for feedback. You know, what can I improve on? I had a 4-week outpatient rotation, 6 weeks, I apologize, outpatient rotation. And at the end of every week, I always approached my preceptor and asked, what are things that I can improve on? And I would take everything she said into consideration, and I would implement it that next week. And it shows when someone tells you that you need to work on something and you immediately start implementing it, even if you're not perfect at it yet, but you're trying, that goes a long way than a student who's just coming in to have the hours pass until they can go home and crack the books open and study because they think, just studying for CK is the most important thing. It's not. Just being present and taking feedback and learning. Every opportunity is an opportunity to learn. Every patient, every note that you're writing. And for me, it was my documentation skills. She really helped me go a long way with documenting. And one of the things that was told to me during my interviews that she had written in my letter of recommendation was my documentation skills. And she was really proud of them. And I have to say, the notes that I write today in residency are because of the skills that she taught me 2 years ago.
Yeah, absolutely. And I think that is another really great point that you bring up, because when you're a resident, like I know this now after being on my first week of floors, you don't have time to be like learning how to write notes. Like there are so many other things to learn. So take it very seriously in medical school and learn how to document properly. This is something big that you can get out of your rotations, because trust me, you're going to be very busy and notes are going to be the last thing on your mind. So learn how to write them good in medical school. And that's a very great point. That can lead to a very good letter of recommendation, because it's an important skill to learn to develop. And it's even can help you with your verbal presentations, because you're constant. When you see it, I feel like your head starts to just format it that way when you're talking about it. So I feel like they kind of go hand in hand.
Right.
In terms of STEP, which is everyone's favorite thing, that and research is everyone's favorite thing to talk about. So for family medicine, it looks like the average score for matched applicants, both US and IMGs, is in the low to mid 220s. So if you could share, was your score about the same, below that, above that, in terms of being a competitive applicant for family medicine?
Yeah. So my step 1 score was average. I fell in the 220s, but my CK score was in the 240s. So you're right. Average step scores for family medicine is around the 220s. Some programs want a little bit lower. Some programs require a little bit higher, but that's about where most of them fall. I feel like we're in this time right now where there's a transition in how much weight is given to different parts of the application. And I think the biggest transition is how much weight is put upon step 1 versus step 2. For so many years, step 1 was the key factor in getting into residency. And I think now it's transitioned to CK because it sort of makes more sense. CK is information we do every day, like we're talking about, and learning every day in the hospital. Step 1's a lot of these, you either know it or you don't, little facts that you probably will never see again in your medical career. So I feel like we're in this really it's cool to see this change because we're living it. We just went through it. And so definitely I think students need to focus more attention on CK now versus step 1, because step 1 is going to become a pass fail. Of course, it's important to pass it on the first try. Every board exam is important to pass on the first try. But now to focus more attention on the key factors, which are switching, and that would be CK.
I absolutely agree. And it's honestly a little bit of a relieving transition. Like granted, we had to go through the stress of, having the numerical score. And fortunately, it is changing to pass fail because that's what it was meant to be. It was never meant to stratify applicants. It was just meant to say, okay, this is the minimum amount of knowledge you need to know to practice as a physician. That's all it was meant to do. And it has gotten like blown out of proportion to this, like, oh, your self-worth is if you get a 270 on step 1. And that's just not what it's supposed to be. It's not, it just got completely blown out of proportion. So I'm very relieved that they were changing it.
The reason I bring that up is because I've been receiving a bunch of messages about CK and step 1. And a lot of people are still freaking out about step 1. And of course, it's a board exam. You have to do well. But it's important to also keep track of that transition that's going on, and to know that board scores aren't the only thing that programs are looking for, especially in family medicine. They want to see, are you personable? Can you hold a conversation? Are you going to act weird in front of the patient? They really, and that's really the whole reason of interviews too. You look good on paper, but how are you in real life? How can you interact with the 4 or 5 different interviewers that you're going to see in person? So definitely step scores are always going to be important. They're boards, they're standardized, they're everybody that's in the same field. But where you really shine are those extra pieces of the letters of recommendation, the CV, your MSPE, your personal statement, of course, which is coming from you. That's really a look, sort of like a view into what you're thinking and your view on the specialty. Those go a really long way too. And so it's important to not just focus on board scores. And so I've been trying to instill in whoever I speak to that, yes, board scores are important, but you really can't forget the other pieces that are at play here.
I absolutely agree. And that's another reason I'm very happy that step 1 is going to change to pass fail, because people unfortunately do apply filters to, narrow down the amount of applications they have. They do have so many, which I get it. But also not doing great on a board exam doesn't mean that you're not going to make a great doctor. And even more so, there's still a trend that's important. So like, even if you don't do great on step 1, but you do great on step 2, I think it's a little unfortunate that they're still filtered out just because their step 1 score didn't make the cutoff, but their step 2 score may be like well above average. So I'm very happy. I think that makes things a little bit less stressful. And you're right, it does. It places a lot more emphasis on the other areas of the application that are actually very important for becoming a doctor, for becoming a good doctor. Yeah. So I'm very happy to hear that. At least in family medicine, they care a lot more about
yeah.
these steps.
I will mention, in none of my interviews did my scores come up, not one. And the difference in both exams of mine, really the number one thing that came up was personal statement, letters of recommendation, and my activities on my CV. Those were mentioned without fail every time.
Yeah, which is awesome too, because I feel like interviews are, obviously very stressful. Once you have 1 or 2, they're not so bad, but you'll realize that most of your interviews also are going to be about the stuff that's on your CV. They're not going to ask you about step scores because, it's just a number, it's on paper. What you're going to talk about in the interview is your personal statement, your hobbies, your community outreach activities, and just things that you're passionate about in general. So, the interview is about a lot more than just the numbers on the application. So I'm really glad that you brought that up, because that's a very important point for people to realize as well.
Yeah.
In terms of research, the other thing that's commonly asked, how important would you say that was for matching into family medicine or even obtaining interviews?
So I ended up receiving 35 interviews at the end of the season, and I went to 15 interviews. I just go to 15 programs. And out of those 15, only one did the PD mention that all of the applicants that were there that day, we were chosen because we had some research experience. And that research experience that I had, believe it or not, was back from college. It was back from undergrad. I hadn't done any research throughout medical school. And who knew that just one program would give me an interview just because I had about a year of experience, of research experience that I had back in undergrad. And it was at a prestigious university program. So I was, in my experience, because I can't speak for everyone, but in my experience in the programs that I applied to, research didn't really play a big role. And I think in general in family medicine, research isn't as heavy as in other specialties.
So do you have any colleagues or any friends who who personally matched into family medicine and didn't do any research?
Yes.
Okay, same.
Yeah,
the
majority.
I try and share that with people as well, because I just want people to know that if you don't have any research, please still apply for residency. It's okay.
Yeah. I'm glad this
applying to
coming up.
Or orthopedics where you absolutely need research. It's not the most important part of your application.
It's
Unless
not
you're
going to
very
make or
passionate
break
about it.
somebody.
If
Yeah,
you're very passionate about it, please do research if you love doing it. But if you hate doing it and you love doing community outreach, do the community outreach because it's still going to strengthen your application substantially. So you mentioned that you had some research from undergrad and that you were chosen for an interview at a program, just one, based off of that research. On the other 14 interviews you went on, how many
yeah,
of them even ask you about research in the interview?
0.
Yeah, similar experience for me. I myself also did some research in undergrad, and then I had a case report published in med school by chance. But only of all the interviews I went on, only one program asked me about research. So
Yeah,
the primary care specialties, I do think it is a little less important. Obviously, if you do it, it does enhance your application a lot, but not having it, I feel like doesn't really make a difference as long as the rest of your application is pretty strong. So
correct.
if
I
you like
agree.
it, do it, but that's my usual recommendation. I don't know how you feel. If you like it, do it. If you don't like it, do the stuff you like. Do, community outreach, go to clinics, volunteer somewhere, whatever makes you happy. But if researching doesn't make you happy and you're not applying for urology, orthopedics, plastic surgery, then, don't freak out if you don't have it on your application is my point.
I agree.
In terms of applying to family medicine programs, there
Mhm.
are, it looks like on ERAS, 2 different types, opposed and unopposed. Can you talk about what this means, pros and cons of either?
Absolutely. So I'm really glad you brought this question up because I think a lot of students don't know the difference between the two. Even just a few days ago, I was talking to someone on the phone who's just going to apply to residency this year and had no idea about opposed versus unopposed, just terms that he's heard. And what that means is in family medicine, our curriculum in residency is basically we go through if you take a hospital, we go through every department within the hospital. We'll spend some time in the emergency department, on labor and delivery, in surgery, on the floors, on a pediatric unit. So we're sort of like visitors all throughout different departments. If you go to a hospital that has multiple residency programs, so it could be family medicine, pediatrics, surgery, that's called an opposed program because there are other residency programs in the same building as the family medicine program. So if you are the family medicine resident and you go to, you're doing your 1 month pediatric rotation, you can be alongside pediatric residents. If you're going in the emergency department for your ED month, you can be alongside emergency medicine residents. Now, if you're in an unopposed program, that just means family medicine is the only residency program in that hospital. And so I sort of look at it as the opportunity like Disney World, an unopposed program, because you get free reign to go in every department. There's no other residents. You are that pediatric resident. You are that emergency medicine resident, the OBGYN resident. And so you get to really take on the role of a resident of that specialty. So you get more hands-on experience. If you go to an unopposed program, you sort of like have to nudge an opposed program, you sort of have to like nudge your way to see patients in a way. And it can really make a difference, the patients that you will see, the types of cases that you can see, and the knowledge you gain, and also how active you can be in certain procedures. So I really wanted to go to an unopposed program. And so I applied to both. I applied to a wide range of programs, and I made my decision ultimately based on the interviews that I got, that I was asked to go to. And I did go to both types of programs for interviews, but ultimately when the time come to rank programs, I decided that the best type of program for me would be the unopposed program. I'm interested in full spectrum family medicine, including obstetrics. And what that means is I basically want to do a little bit of everything. I want to see newborns, I want to see kiddos and adults and elderly and pregnant women. And you really get that experience by going to an unopposed program, because you get to be the resident of that specialty.
That was a very great explanation of that. Actually, myself, I just learned about unopposed versus opposed programs like a few weeks ago, and I had no idea they even existed. So I feel like you're right. A lot of people, even getting ready to apply, as you mentioned, don't know that these existed, let alone what they mean. So that being said, when you applied, you mentioned you applied to both opposed and unopposed programs. Um, do you think, you mentioned also that you're considering doing an OB fellowship. So do you think that there's any like pros or cons from either the unopposed or opposed standpoint in terms of securing a fellowship if that's your long-term goal?
Sure. So opposed programs, you'll find those more in the big cities. A lot of university programs, because they're a hotspot for residency, different types of residency programs. And that way you can make a lot of connections, and it may help you out in the long run to get a fellowship. But at the same time, you may not necessarily be gaining those really important skills and knowledge that you need, because there's always someone else that you sort of have to compete with in order to get the patient. A lot of unopposed programs are, in my experience, are located in the Midwest. I applied to the Midwest and the Northeast, and the majority of the unopposed were in the Midwest. And yes, we're a little further out away from major cities, but that's where you get more hands-on experience. And to be honest, my obstetrics curriculum right now is the equivalent to a lot of fellowship programs that I've been researching. I've been doing 24 up to 28-hour calls every 3 days while I was on OB, and I realized a lot of fellowship programs make their fellows have those types of schedules. So I'm sort of living and experiencing the schedule of a fellow, and I didn't think I'd be able to do this at an opposed program because there'd be the OBGYN resident there. And maybe there could have been some picking and choosing into which cases they see over which cases I see. And so you definitely get more hands-on experience. You'll see a lot more, but ultimately it depends on what an applicant's looking for. You know, just because it's an opposed program doesn't mean that it's not going to be great and you're not going to learn. That's not what it means at all. But it just depends what you're looking for. Are you looking to be more hands-on and to really treat everybody in the family, or are you looking to just get the basic knowledge of a little bit of everything and have an idea of how to do things?
Okay. Yeah, I think that is also a really great explanation. So thank you for sharing that, because I feel like I'm learning so much from you about the family medicine process that I had no idea about. So it's been wonderful. In terms of, you mentioned you applied to the Northeast and the Midwest, correct?
Yeah.
How did you decide when you were sitting down with your ERAS application in front of you and they were like, okay, now what programs do you want to apply to? And there are many.
I remember that very clearly, especially the few nights before having to submit your rank list. I remember it just like it was yesterday.
Yeah, honestly.
Yeah.
It does feel like it was yesterday. It's hard to believe we've already started residency.
Yeah. I mean, really, I just, at the end of the day, I chose according to what I really could see myself enjoying. I knew I wanted to go to an unopposed program. The majority were in the Midwest. And even though there were some really good and wonderful programs in the Northeast, and I'm actually originally from the Northeast, I'm from New York City.
I see the bridge in the background.
Oh yeah, there you go. I didn't even realize I was sitting in front of that. You know, it just wasn't, I didn't think I was going to get the experience that I was looking for and that I was hoping to get out of residency at the end of the 3 years. And so, you know, a lot of people say, just choose on based where you want to go, like geographically speaking. And yeah, you know, that's important too. But at the same time, you don't want to end up going to a program that you don't necessarily like, but you chose and ranked high just because of it might be closer to family or friends. Really just think about what you want to do and what you want out of the 3 years of, or however many years in other specialties of residency training, and what you want to come out knowing. And that also guides the questions you ask at interviews, like you mentioned earlier. And that's how you realize what you want, by getting your questions answered. And to do that, you need to know the questions that you want to ask. So it comes all the way from the beginning of the interview season and just knowing what you want. And you're not going to know off the bat. You're going to figure it out too throughout interview season and speaking to others. But at the end of the day, rank according to how you would like, according to the programs you would see yourself being great in, and you could see yourself getting the knowledge and the experience you want.
Yeah, that's absolutely fantastic. And then in terms of, so as like an IMG, when you sat down and you were like, okay, I need to decide which programs I want to even apply to back in like September or August of last year. There's
way back then.
There's so many family medicine programs, and I think a lot of, you know, IMGs, Caribbean students in general, they kind of wonder, you know, what is the number of programs I should apply to? And obviously, like in a specialty like family medicine, you can't apply to all of them or you will be broke for a very long time.
Yeah.
So how did you kind of narrow down where you were going to apply?
So first off was location and not just specific states. I just chose regions of the US. I have roots in New York and the Northeast, and then I did my rotations in Chicago for 2 years, so I became familiar with that area. So I really wanted to just stick to Midwest and Northeast. And then in those regions, I sort of applied broadly. And the only reason I did that was because my application, I submitted it a few days after programs could start downloading applications. I was in a really intense sub-internship at that time where I was sometimes working 17 hours a day, and it was intense,
Wow.
really bad timing. But I thought I was Superwoman and I could do it, and it ultimately worked out well, but it was difficult at the time. And so there were some pieces in my application that I really wanted to perfect prior to sending out. So I didn't know how that would affect my chances of getting interviews. So I applied to about 250 programs. And in a way, you're right. We're told as IMGs, apply to as many programs as you can. I don't think it's necessary. I don't think it's necessary at all. I think, about 200 programs would be enough for people to apply to. I've heard 300, and I think that's a little bit overkill. And like you said, it burns a hole in your pocket. So really, I just applied broadly, and then based on the interviews that I got, I did more research, even more at that point, and then decided, does this program seem like a good fit for me, and does it seem like it has what I'm looking for or not?
Okay. So basically, you decided on your location, and then you applied to about 250 because you submitted it a little bit later, and you were a little
Correct.
unsure. Did you use anything did you take into consideration that you were an IMG at all in this point, or did you apply regardless of how many IMGs they accept?
I applied regardless of whether they even accept IMGs or not. I was told by my school to apply, the majority of programs that you should apply to should be community-based programs, because that's usually where a lot of IMGs are accepted, not so much university-based programs. But I wasn't going to limit myself. So I applied broadly, and actually the majority of my interviews were from university programs. And I wouldn't have gotten those interviews if I had taken that advice and not even applied. And I even got interviews from programs that don't have any IMGs, never accepted an IMG in the last 5 years or so. And I don't know if I necessarily would have been in that position and in that seat at that interview if I had listened to that piece of advice.
Yeah, I agree. And I think, I understand why they mention it. It's obviously they want us all to match. And like you said, it's like a security blanket applying to community programs. And of course, there are many great community programs, but I don't think that just because, you have this IMG label across your face, whether you're from the Caribbean, wherever your school is in the world, I don't think that you should limit yourself to just applying to community programs. I do think you'll have a better chance. I think that the chance is higher, but I don't think that it's by any means impossible to match at a university program just because you have IMG stamped across your face.
No, you're absolutely right. And there's actually, sorry, go ahead.
I was going to say, now you're at a university program as well because you decided to not take that advice. I am at a university program as well because I also decided not to take that advice.
There you go. So I feel like throughout this whole process, you sort of have to keep your ears open and take all the pieces of advice that come your way, but then you have to filter them too. And you have to take a look at your own situation and see how much is that piece of advice useful for yourself. But I think another thing that's really important to mention here is a lot of times I was told prior to applying, if you don't have all of your board scores and information in by September, well, for us, that deadline was September 15th for our year, don't even apply. I'll wait a whole nother year and apply the next year. I'm not quite sure if you heard that as well. So I think that's really, extreme. And I think people just have to take a look at their own situation. For me, I couldn't find a CS date for like 4 months. I had my CK scheduled on August 13th in Chicago, and I was trying to find a CS date the entire time, and I was nervous because I couldn't find it, and I was scared if I was going to have to postpone a whole year. And I eventually got a CS date that was scheduled for 3 days after my CK date, in a different city. I took my CK in Chicago, my CS was in Philadelphia. And so because I took it mid-August, I didn't have my scores back until mid-October. So not only did I apply 5 days late in the cycle, I also didn't have a CS score. But that didn't necessarily stop me from getting interviews. I got about 10, 12 interviews without even a CS score from some pretty competitive non-IMG friendly programs. So that goes to show you, if you have a solid application and, the big boy exams, or the CK and the step 1 are there, people are scared, should I just, at this point, CS is not really in question at the moment, and who knows what's going to happen. But this can also be used in the future, hopefully when things resume back to normal. If someone doesn't necessarily have all the pieces there in terms of board scores, that doesn't necessarily mean just stop and have to reconsider everything again in a year.
Yeah, I think
and especially now, things are a bit more lenient given the COVID situation.
Exactly. And I think that's a great point, even for like the non-pandemic years, where like when we applied, like you said, the application opening date was the 15th of September, when, programs could start, looking at your application. But a lot of programs don't look at any applications until the dean's letter is uploaded anyways, which is traditionally 3 weeks later on October 1st. This year is going to be different. Programs are going to have access to the dean's letter and the application at the same time because everything is delayed. But in past years, and perhaps in future years, when you have that gap, I think a lot of programs don't even start looking until they have the dean's letter in place. So if it's, in our case, if it's September 19th and the application opened on the 15th, I think it's okay. Maybe there's 1 or 2 programs you miss out on, but okay, if you apply to like 120 or so, okay, so you missed out on 1 or 2. I think that's I'm glad you brought that up, because that is a really great point. And it's great to hear from someone who actually had an experience where they weren't submitting their application on the first day that it opens, or even the night or 2 before. So I'm very glad that you shared that, because I actually haven't heard of anyone who submitted it.
Yeah.
So I'm very happy that you've been so
no one's expecting to be in that position. And really I have to thank my older brother, because he's the one who tried to keep my spirits high and really pushed me to get everything in and apply and try it. And I'm so glad I did, because I got so many wonderful interviews at so many great programs, and I couldn't be happier on this day. And so it goes to show you that every little piece of advice that comes your way, which a lot of pieces do, especially as an IMG, isn't true. And you should just take it with a grain of salt and really see how it applies to your own situation before you use it.
Yeah, I agree. Like you have to know yourself, because obviously some of that advice does, apply to applicants, depending on what you're applying for, or depending on what your application looks like. Where you apply and where you're going to be competitive at is going to be different, but you have to know that about yourself. You have to self-reflect. You have to have insight as to how strong of an application you actually have. But like you said, your application was pretty strong all around without a CS score. So really there's no reason you shouldn't get any interviews, especially for a specialty that cares about things other than USMLE.
Right. Very true.
So you mentioned you did your rotations in Chicago, you said?
I did. Yes. I did all of my rotations in Chicago.
Okay. So then you did not match at a program where you did your rotations, because you're now in Wisconsin. Did you do any audition rotations for family medicine?
I did not. I actually just stayed, believe it or not, the 2 hospitals that I was in for the 2 years were just a block apart from each other. So I stayed in that area the entire time, and only one of those hospitals had a family medicine residency program. But given that and it was opposed, and given that I didn't necessarily want to go to an opposed program, I didn't apply to that hospital. So all of the interviews that I got were from programs that they had never even met me. They'd never seen my face other than the picture on ERAS.
Right. Okay. So yeah, that's an interesting thing. I feel like a lot of the people that I've spoken with who've matched into various specialties actually have done audition rotations, and then ultimately didn't wind up matching at the place that they did the audition rotation, but not because the program didn't pick them. It's the applicant didn't pick the program, they didn't rank them high or something like that. So That's interesting. In terms of yourself, so on interview day, it's really important to just, be who you are, have a smiling face. What do you think, in terms of things about yourself, personal qualities, self-characteristics, made you a good family medicine applicant and make you a good fit for the field?
I think it really goes back to what made me go into family medicine to begin with. And I growing up, I was very close with my grandmother, and she was quite sick with a lot of medical conditions. And I had spoken a little bit about her in my MSP actually. And not even though I didn't necessarily know I wanted to go into family in the beginning, I knew that I wanted to go into a specialty where I can form bonds with my patients based on the experiences that I had with the physicians of my grandmother, and how much the time that they spent speaking to us and educating us and listening to our concerns and our questions really affected us and meant to us. And so I knew I needed to be a physician that could provide that. And so it really, it comes from the heart, like you mentioned earlier, with questions and what you care about. Being honest and true, and not trying to give answers that you think the interviewer wants to hear, just answering questions truthfully and honestly, and that's where your true colors and your true personality shows. And believe it or not, they've done this so many times. Interviewers have interviewed so many people that they can tell who's being honest and who really wants to be in this field because they care and they love what the specialty stands for and what someone can do in the specialty that you're interviewing for, versus someone who showed up just because they got an interview.
Right.
So I think, sorry, go ahead.
No, I was just going to add that I think that is a really great point that you make, because a lot of people, I feel like internal medicine, pediatrics, surgery, a lot of people kind of apply sometimes to family medicine as a backup when they're not actually passionate about it. And I think that can be very unfortunate, because if you're applying to something, not even necessarily family medicine, but literally anything as your secondary specialty. I know myself in internal medicine, a lot of people apply for internal medicine as like a second choice as well. But if you can't convey that passion on interview day, people are going to be able to tell, and you're not going to match there anyways, which ultimately makes it kind of pointless to even bother applying, because
Right.
You're not going to get ranked very high because they know you don't want to be there and they know you're not
Right.
going to be happy. So I think that was a very good point that you brought up also, because you're right. I mean, even the same thing in internal medicine, like so many people apply and then interview when that's not like what they actually want to do. And program directors they can tell who's who.
Very much so. Very much so. I actually was asked once if I had applied to any other specialty, just because my letters of recommendation, I had one from a family physician, one from a pediatrician, one from a physician in internal medicine. And the reason I did that is because I feel like in family medicine, it encompasses every specialty.
Absolutely.
And so I wanted to show that I was pretty good in a little bit of everything, And unfortunately, with just one person, they took that as to mean, did this applicant apply to other specialties? But out of dozens and dozens of people that I interviewed with over the interview season, it was just one person who asked me that. But they do ask. They will flat out ask sometimes.
Yeah. And I think the great thing that benefits you as well is you just listening to you talk now about family medicine, like you're very clearly passionate about it. So even like follow-up questions beyond that question of, oh, you have these 3 letters from various specialties. Do you even like family medicine? Like it's very clear when you're talking about it that you're passionate about it. So I think that, regardless of that question being asked, you were perfectly fine in that interviewer's eyes.
Yeah, I actually had given them the answer that I just gave now, and they realized I want to say they sort of felt a little stupid in asking me to begin with.
So for sure. And then before we finish up, I was just thinking about, in terms of the struggles that IMGs face in terms of applying in general, both of us being IMGs from the Caribbean, do you feel that there is any particular struggle that stands out to you, and how did you overcome it?
I'm really glad this question was brought up, because this is something that I found myself witnessing quite often. When you start medical school, whether it be in America, whether it be in the Caribbean, whether it be elsewhere, you're given an opportunity. You're given the opportunity that you were looking for to give it your best shot, put your best foot forward, and begin the journey of becoming a doctor and ultimately becoming not just a physician, but a great one. And I think a lot of students that I've met in the Caribbean wonderful people, very bright. They almost felt like just because they were starting off in the Caribbean, they were already starting off at a disadvantage. And I oftentimes found myself trying to have and this was oftentimes coming from some good friends of mine. So I oftentimes found myself trying to have them look at it in a different way. If you give it your all with the opportunity that you're given, if you keep your head down, you study hard, you take it seriously, you put your best foot forward, and you give it all you got, you're going to come out successfully. You matched into a university program. I matched into a university program and the specialties that we were looking to match into. So we didn't just match, we got what we wanted. And I think it's really important for IMGs to know that from the beginning. You're given an opportunity, and what comes out of it is what you put into it. And so if you don't put much effort into it because you think you're at a disadvantage from as being an IMG, that's how the story is going to play out. But if you walk in being positive and optimistic and determined that you're going to achieve your end goal, it's going to make all the difference day and night.
That was the most perfect answer to that question I feel like I've ever heard. That exceeded expectations so much. Yeah, I absolutely agree. Even when you're going into Caribbean medical school, you're going to hear a lot of bad stuff. You're going to hear some good stuff from people like us. We obviously have a lot of great stuff to say, but the people who are telling you the great things, I feel like, are usually the people who took that opportunity and made it.
Ran with it, really.
Yeah, absolutely.
Yeah.
I 100% agree with that. And I think sometimes a lot of the negative advice kind of comes from, abusing the opportunity, essentially. Oh, I want to go to the island and, drink Mai Tais and just sit on the beach, which is like fine, but like you're going to be pretty far behind in lecture if you do that every day.
Absolutely.
So yeah, like you said, you have to make the most of it. It's the opportunity you're being given, but nothing's going to be spoon fed to you in medicine at all. You have to work for everything that you get. And like you mentioned, we both matched at places where we wanted to be. This is where we wanted to be. We're not just content with, where we are. We're happy just floating along by. Like, we both worked very hard to get where we are today. And I think you're right. It's because we took the opportunity we were given and we ran with it, and we weren't going to take no for an answer. So.
And that's actually the one line that I really dislike, which is, I'll take wherever I get. And I've heard that many times before, and it makes the hairs on my arm rise when I hear it, because that's not necessarily true. We have a say in where we want to go. We don't just have to apply to programs that only take IMGs. We can reach for the stars and apply to really wonderful, prestigious university programs that can offer us what we're looking for, and give us the experience that we hope to have as a future physician. Really, it's how much you will work for it to get it.
Yeah, I absolutely agree. So thank you for that. That was very inspiring. That made me want to go back to medical school and do this all over.
And start all over again.
Crazy.
I'll meet you there. I'll meet you on the island.
Perfect. Perfect. So that's all the questions I have for you. Do you have anything you would like to share that you feel like we didn't really chat about today?
The only other thing that I wanted to mention was, if an opportunity comes along to take on like a leadership role especially throughout rotations, I think it's really important for students to jump on that, because in my third year, we had something called a lead student and of each core rotation. And which I didn't know at the time, that not every hospital and not every rotation in every hospital has a position like that. But one student was chosen for that specific rotation, and they were sort of like the chief resident in a way. And that actually came up quite a bit in my interviews as well. I was lead student for 3 out of my 6 cores. And they were family medicine, OB, and IM, which were the 3 biggest things that I was interested in and are very fall into family medicine. And it oftentimes they're asking me, so this position sort of sounds like what a chief resident will do. Wouldn't you say? I'm like, yeah, I guess so. And so they really want to see people that are not, that are really going to take advantage of the position, of the situation they're in, and really try and, even if there's something they're not comfortable doing, really put their best foot forward and show that they can do it and have experience in it. And so I really think that's something that students should really keep an eye out for. And if an opportunity like that comes along, to really take it.
Yeah, I think that's a really great point because, as when you're in a leadership role, like in rotations, you have to remember that you're going to be essentially a leader, a lifelong leader. Like obviously we're lifelong learners, we know that, but you're also a lifelong leader. Like communities are always going to look up to you. So you are going to be in a leadership role always. So I think taking on those extra responsibilities is definitely beneficial. And I think it will even make you a more efficient resident. You have so much on your plate during residency that if you can handle that while you're in medical school, I think your transition to becoming a resident is going to be a lot easier. And I think programs probably see that. If you can handle a leadership position, they're like, oh, okay, this person's going to be just fine during intern year. And it gives them a little bit more confidence in you as well. So thank you for
Right,
sharing that. That's really
absolutely.
great advice.
Yeah. But I think in general, in family medicine, and really with any specialty, I feel like this applies to, once you decide that it's the specialty you'd like to apply to, really put your best foot forward in any family medicine oriented rotation that you do, and become close with the preceptors and pick their brains a little bit and try and seek out opportunities that you can spend a little bit more time with them. Maybe not in that specific setting that's meant for your rotation, but maybe they go and visit other clinics and they need a little bit more help and an extra pair of hands. And it goes a long way. Always ask questions, always show interest, because when you ask them to write that letter of recommendation, that's what they're going to remember about you, that you were always proactive and you always wanted to help out and you always wanted to learn more. And that shows a lot about who you are as a person and how much the specialty means to you. And eventually, in the end, it can't do anything but help you.
Absolutely. Thank you for sharing that. You're absolutely right. So I don't have any other questions for you. So if you have nothing else you'd like to share, I would just like to thank you so much for coming on and talking about family medicine today. I have a lot of people who are interested in family medicine, and I know this is going to benefit not just them, but many, many, many students, IMGs, and even US students in the future. So your advice was incredible. Thank you so much for sharing and agreeing to take
Thanks so
time
much
out of
for
your
having me.
very busy residency schedule to talk.
Yeah, absolutely. I really enjoyed speaking with you about something that I'm very passionate about. Thank you.
You're welcome.